As a pharmacy owner, you want to grow your NHS items, increase patient loyalty, and improve time-consuming processes. The MedAdvisor app offers a way to automate repeat prescriptions. Patients can order directly from their GP at any time, helping to streamline your pharmacy workflow. You can also improve loyalty by sending alerts to patients when their prescription is ready for collection, or if an item is out of stock. Improve the patient experience and your business with the MedAdvisor app. Register your interest today.
Good evening, welcome and thank you for joining us on tonight's webinar with MedAdvisor, the MPA's preferred business partner for repeat prescription apps. I'm Simon Tebbert, Head of Member Relationships at the MPA, and my relationship team speak to pharmacies every day, and we clearly see the need for a digital solution to help manage pharmacy workflow and save time. We think the MedAdvisor app is the best solution in the market, making it really easy for patients and pharmacies to manage repeat prescriptions. MedAdvisor are a tried and tested solution being used across the globe, incorporating over 27 years of experience and expertise with their solution. The holistic solution is proven to drive items growth, improve patient loyalty, and increase adherence through digital adherence programs. Tonight, we will hear from Jamal Butt, MedAdvisor UK Chief Executive, and Gwyn Williams, Head of Business Development in the UK. Jamal and Gwyn are pharmacists with decades of experience in various senior positions within community pharmacy, and they're both really passionate about helping pharmacies survive and thrive, especially in these unprecedented times. They've listened to feedback from MPA members and adapted their solution to ensure it's as easy as possible for pharmacies and patients. During the webinar, you'll get an insight into how the app works from a patient and pharmacy operational perspective. A number of the frequently asked questions will be answered at the end, and you have the opportunity to ask further questions via the chat function. Following the webinar, further information and an option to book a call with Gwyn is available through the MPA website. It's now my pleasure to introduce Jamal Butt, Chief Executive of MedAdvisor UK.
Thanks, Simon, for the introduction, and great to have you all join us this evening. I'm Jamal Butt, CEO of MedAdvisor UK, and I'm excited about sharing how MedAdvisor can help you and your businesses. And it's fantastic to be partnering with the MPA as the recommended solution for independent pharmacies.
Evening everyone, my name is Gwyn Williams. I'm Head of Business Development for MedAdvisor in the UK. During the webinar, we'll show you how our solution works, and I'm sure you'll have lots of questions that will come out of the demonstration. So at the end of the webinar, you'll see my contact details, so please don't hesitate to get in contact to book a follow-up call or ask me any other questions.
I'd like to start with a short overview of MedAdvisor. Our purpose is to help improve the way patients manage their medication, and in doing so, empower them to feel more in control. And we do this by using our digital technology to make it easy for them to order repeat medication and to provide them with digital content to help them be more adherent to their medicines. I guess as a pharmacist, I understand how challenging times are for independent pharmacies, especially during the COVID pandemic. We've had to deal with so many changes to the ways of working, changes to our workload, and patient expectations. That's not to mention the backdrop of reduced government spending. So it's really important that community pharmacy stays at the heart of local communities to really help patients get the best possible outcomes. Our app can help drive loyalty to your pharmacy and allow you to compete at a time where digital solutions are playing a bigger role with patients, ultimately helping you to survive and thrive for the long term. MedAdvisor operates across 4 continents and provides digital solutions to millions of customers. In fact, we've been supporting patients for the last 27 years. We have over 65% of the Australian pharmacy market using our app. We've got over 24,000 pharmacies in the US involved in solutions, and we're listed in the stock market. I'm pleased to share that we're also now live in the UK since the beginning of the year. And our solution here is tried and tested. And we've been working really closely with the NHS and pharmacy businesses to ensure all the necessary integrations are in place, and the product is tailored to the UK pharmacies. We believe we now have the best solution in the market, and the MPA agree. As I said, our app is now live in the UK, and we'd be delighted to bring your pharmacies on board. I'll now pass to Gwyn, who will tell you a bit more about our solution.
The MedAdvisor solution comprises of a world-class medication management patient app combined with powerful in-pharmacy software. At the heart of our solution is the free mobile app, which patients can download free of charge from the Apple App Store or from Google Play. The app makes it really easy for patients to see their current repeat medication list and then quickly and easily select those medications they wish to order, and those orders are then sent directly to the patient's GP. The second part of our solution is the in-pharmacy software, and this allows the pharmacy to see those orders that the patient has placed using the app. The pharmacy software is accessed via an internet browser, so it works with all PMR solutions. We've designed the platform to make it as automated and simple as possible to reduce pharmacy team workload. So it's really easy to use, and the pharmacy team only need to go into the system a few times each day to perform very quick actions. Lastly, we also work with pharma companies to provide digital adherence programs. I'll go into this in a little bit more detail later on, but these programs can really help improve patient adherence and persistence by encouraging patients to take the medicines as prescribed. The MedAdvisor solution works across all popular devices and platforms. As well as having the option of using the app on the patient's phone, they can also use a web app that can be accessed from any device that has an internet connection. This enables even your elderly patients who don't have smartphones but are able to use the internet to still sign up and get the benefits from using a digital solution. I'm now going to play you a short demo which shows both the app and the in-pharmacy software called Plus One.
The MedAdvisor app and Plus One in-pharmacy software allow you to digitally engage with your customers to help them better manage their medication and repeat prescriptions. The MedAdvisor app gives your patients the opportunity to take control of their journey to better health. After discussing the benefits of the app with your patients and obtaining their consent, you can send the customer an invitation to download the app. To do this, select Invite Patient in the top right-hand corner of Plus One. You can search for a patient and search the PDS to view the patient profile. Add the patient's mobile phone number, and you have the option to add their medications from the summary care record or add the medications manually. The patient also has the option to add their medications via IM1 pairing. Select Send Invite, and the patient will receive an SMS with a unique invite code that expires after 7 days. The patient simply clicks on the link in the SMS, downloads the app from the App Store or Google Play, just like any iPhone or Android app. They can open the app and select Register. When asked if they have an invitation code, they will select Yes and enter the invitation code as well as their date of birth as an important validation step. Their validation will show as successful, and from here they can complete the account setup by adding their email address and phone number as well as creating a password. They can agree to the T's and C's here, as well as give consent for the pharmacy to access their summary care record. They can also ask the app to keep them logged in here. Selecting Next will complete their registration and give them access to the app with their repeat prescriptions automatically loaded. You can see their medications and the day's supply left for each medication. They'll receive an email and in-app notification when they are running low. To order, the patient simply selects the medication they would like on the home screen and selects Checkout. Customers are also able to sign up to the MedAdvisor app and connect to your pharmacy without an invitation code. After downloading the app from the App Store or Google Play, a patient can launch the app and select No when asked if they have an invitation code. They can enter their details and select Next to create an account. They will be asked to search for their current GP surgery by selecting Let's Get Started. They can repeat the same steps to find your pharmacy. The next step is to add their email address and phone number. Finally, creating a password and selecting Next will take them to the last step of agreeing to the T's and C's and nominate your pharmacy to receive prescriptions electronically using the electronic prescription service, as well as give consent for the pharmacy to access their summary care record. They'll select Confirm, and their registration is complete. From here, they can use IM1 pairing with their GP surgery or manually add their medications. You will be notified in +1 of the app sign-up request. The in-pharmacy software improves pharmacy workflows, efficiency, and sends the patient-initiated repeat prescription requests automatically to the GP via IM1 pairing, email, and eFax. You also have the option to print prescription requests for delivery to the GP surgery. Sign up your patients quickly and easily by selecting the Invite Patient button here. App orders, remote sign-up requests, and patient messages all appear in the inbox with simple quick actions to save you time. The patient screen allows you to view and update patient information and communicate directly with a patient via one-to-one messaging. The Surgeries tab gives you access to your connected GP surgeries and lets you choose your script request method for each clinic and set the time before you would like to be alerted that the script request is overdue. And finally, your Settings tab is where you can manage the pharmacy details that appear in the app for your customers, including trading hours and contact details. The +1 platform is integrated with your NHS smart card reader, the patient demographic service, and summary care records, and helps you retain your patients through increased loyalty, improve patient workflows to save time, increase adherence, and more. There are more exciting features coming soon. Help your pharmacy survive and thrive with the MedAdvisor app and in-pharmacy software.
As we've been preparing to launch our solution, we've been listening very carefully to pharmacy owners about what's important to them. We've adapted our solution based on that feedback and made significant changes to ensure our solution is best in class. I've spoken to hundreds of pharmacy owners over the last 6 to 12 months, and here are some of the key themes that I've been repeatedly told are important considerations when choosing an app. The first consideration is data ownership, and this question comes up a lot. As more services become digital, the control of data becomes ever more important. Many pharmacy owners ask me who will own the data when a patient signs up to the MedAdvisor app. Each patient owns their own data, but the important thing to consider is who is the data controller. We recognise that you, the pharmacy owner, are the data controller, and we are your processor. This means that the customer is your customer, and we are only acting on your behalf. If you ever chose to not use an app or change app provider, as you are the data controller, you retain your customers. Secondly, it's important to consider whether an app you choose to use will help drive loyalty to your pharmacy, or could it potentially create instability. Consider whether the customer can view competitor pharmacies and change to a different pharmacy in app with just a few clicks. If you sign up the patient, you don't want to lose the patient to a competitor. Our initial plan was to allow patients to move between pharmacies in the same way that nearly every other app provider works. But the feedback came back loud and clear that this wasn't a good idea from the pharmacy owner's perspective. What I heard many pharmacy owners say to me who were already using an app that had their pharmacy as part of a network was they didn't feel confident to actively sign up all of their patients to use the app, as there was a risk that they could move to an alternative pharmacy. What they said they were doing was only offering the app to those customers that they felt they would lose if they didn't offer them the app, but they weren't talking to loyal customers to encourage them to use it. Therefore, they were missing out on all the benefits of automated and repeat prescription ordering, as they weren't offering the solution to everyone. We really want our app to work for all your patients, and for you as a pharmacy owner to be confident to know that you'll keep your patients if they sign up to the MedAdvisor app. Integration with GP online services is also a key consideration, as IM1 provides a streamlined way for patients to order their prescriptions using the medication list that's generated directly from the GP clinical system. GP online services are becoming increasingly more popular, so it's important that any app you choose has these integrations. On an earlier slide, I talked about web ordering for non-smartphone users. Many pharmacy owners have told me that their elderly customers don't have smartphones, so choose a solution that allows patients to order using any internet connected device, for example, a desktop or laptop, as well as a smartphone. We know that many elderly patients currently use their GP online ordering system, but don't have a smartphone. So if there is a web-based option, you can offer the solution to everyone and not have to ask patients if they have a smartphone when signing them up. Lastly, with increasing use of batch ERD prescriptions, you want a solution that works for all patients, both now and in the future if they swapped onto batch prescriptions by their GP. Your solution should handle both batch and regular prescriptions and automatically route them to you or the patient's GP as appropriate. An added advantage of our solution is we support patients by providing digital adherence programs. These programs are commissioned by pharma companies and normally include 12 messages sent over a period of 12 months. The messages are educational and are designed to drive both adherence and persistence. Digital adherence programs benefit patients, pharmacies, and the pharma. Patients experience better health outcomes as a result of taking the medication as prescribed. The messages help people understand the reasons for taking the medication, how it works, and how to manage side effects. As a pharmacy, you will benefit by your patients having more items dispensed each year as a result of improved adherence. Also, we'll share a percentage of the revenue from the pharma with you as the pharmacy owner. And lastly, the pharma company also benefits by delivering a better patient experience, as well as getting a return on investment. So why choose MedAdvisor? We're really committed to working in partnership with you, and your success is our success. We'll do everything we can to help you, including supporting you with your implementation plan, training, and then providing ongoing support. As pharmacists ourselves, we understand the community pharmacy market and the challenges you face, so we're able to listen to your suggestions for enhancements and translate the requirements back to our tech teams. I talked earlier about the importance of who is the data controller. If you sign up with us, you'll be the data controller and we'll be your data processor. We have a web version of the app, which means that any of your patients can use the solution irrespective of whether they have a smartphone. The MedAdvisor app automates the ERD prescription process, so if your patients change onto ERDs, they can still continue to use our app. We have IM1 peering with the two largest GP clinical systems, EMIS and TPP System 1, who between them account for over 97% of the GP practices in England. Digital adherence programs really help support patients get the best outcome from the medicines. And lastly, being a global organisation, we're able to bring insights and learnings from around the globe. We've listed some of the key benefits for your pharmacy below. Being able to compete in an increasingly digital marketplace will allow you to retain existing customers to drive patient loyalty, but also gain new customers who are looking for a digital solution. This will enable you to increase your NHS item market share and drive growth. Our automated solutions help improve workflow, which will reduce phone calls, reduce your administrative burden in managing repeat prescription requests on behalf of patients, and help you release time to redeploy resource to deliver other tasks, such as providing pharmacy services. You can process app orders at a time that suits you, enabling better management of dispensary workflow so you can spend more time with your patients. When you offer your patients the convenience of repeat prescription ordering via the app, which requires them to nominate your pharmacy for EPS, you'll grow your EPS nominations. Use of the MedAdvisor app leads to improved adherence of 20%, delivering increased repeat prescriptions and more pharmacy visits, resulting in more revenue for your pharmacy. And last but not least, MedAdvisor allows patients taking high-cost medicines to order the medication well in advance, ensuring you have the right stock at the right time, which can help you control cash flow. So how much does the MedAdvisor app cost? The monthly license fee is just £40 per pharmacy per month. This represents great value for money, as we regularly see an 8 times return on investment in pharmacies that use our solution through saving time and increasing prescription item growth. We have no minimum term or minimum notice period, So we've tried to make it really easy for you to join with no risk. What this means is if you'd like to join for a couple of months to see how you get on, you can do. And if you change your mind, you can easily cancel the agreement and leave.
So we've covered quite a lot of ground so far today, and no doubt you'll have some questions. Not all of your questions will be answered in this FAQ session we're about to do. So what we'll do is we'll review all of the questions in the chat function and circulate them to everyone on this call. Gwyn, here are some questions for you. Why should I pay for my patients to use the MedAdvisor app when they could use the NHS app instead?
Yeah, really good question, actually, and something I do get asked a lot. The NHS app is clearly a very, very good app and very widely used by, so many people across the United Kingdom, especially with COVID actually driving uptake as well. I suppose that from a pharmacy owner perspective, though, if the patients do actually use the NHS app to order repeat prescriptions, then the pharmacy doesn't have a competitive advantage. I suppose in reality, it's really easy for patients to move pharmacy from 1 month to the next and change their EPS nomination with a click of a button. So if you did go and speak to all of your patients and try to move them all onto the NHS app, potentially you could be creating instability and actually encouraging patients to potentially find it really easy to swap to a different pharmacy. So with the MedAdvisor app, when patients are signed up, they can't move pharmacy in app. So you do have a significant competitive advantage by your patients using the MedAdvisor app to order their repeat prescriptions. Also, with the NHS app, when patients place an order, the pharmacy isn't included in that order process, which means that when the patient places an order, the pharmacy doesn't have visibility. With the MedAdvisor app, you can see what people have ordered. So that's especially useful if you have high cost drugs that you don't normally stock. So you can see that your customers that are about to place an order or have placed an order. And you can therefore manage your stock holding and therefore your cash flow a lot better by actively managing, those particular lines. Also, because you can see what's been ordered, and you can then actually watch out for when they come back. You're then able to actually communicate with the patient to tell them when it's ready. And you will also have visibility of whether that order was sort of received on time or whether it was overdue. So really easy for pharmacy owners to actually tell patients to come and collect their medicines, or also if there's any problem as well, they can then communicate and tell them. The third and sort of other consideration to think about as well is just around ERD batch prescribing. So with batch prescribing increasingly becoming more common, especially as a result of COVID, then it's important to have a solution that can handle both ERD and non-ERD prescription requests. With the MedAdvisor app, the patient can place an order, and if there's an ERD batch remaining on the spine, then the order gets sent through to the pharmacy. However, if there are no batches remaining, then the request gets sent through to the GP. So it makes it really easy to actually manage those orders and help pharmacy workflow.
Thank you. So some clear benefits for using the MedAdvisor app there. Just a question about PMR systems. Does the MedAdvisor solution work with all of the PMR systems in the UK?
Yes, it does. So our system is integrated with a number of NHS systems. So we integrate with the PDS, the Patient Demographic Service, and also with the summary care records. We're also integrated with GP clinical systems, the two key ones, both EMIS and TPP System 1. Our in-pharmacy software is provided via a web browser, so it's not actually sort of linked to any particular PMR provider, which means that it can actually work regardless of which PMR provider you choose to use, either now or in the future, should you ever change.
You mentioned working closely with NHS there, and can you tell me a bit more about IM1 peering, and does MedAdvisor have this function?
Yeah, sure. So IM1 stands for Interface Mechanism 1, and it's also known as GP Online Services. What it sort of does in a nutshell is it enables patients to have a direct connection to the GP practice for them to be able to actually see their repeat prescriptions that are held on the GP system. So the patient will go to their GP practice, prove who they are, get their linkage key. They can then add that into sort of third-party apps such as ours, and that then allows them to have a live feed and all of their repeat medicines are displayed within the app. They can then really simply and easily select what's required, and that order goes directly into the GP clinical system. So it's much better for the GP as well, and it's a streamlined way for them to receive orders. We, as I mentioned earlier, are paired with both EMIS and TPP System 1. There are 4 providers in England. Those 2 are by far the largest players, and between them they have over 97% of the GP systems in England. So the MedAdvisor app does connect with virtually all of the GP systems, over 97% in England.
Thank you. Can the MedAdvisor app be used for pharmacies to send patients messages?
It can. So there are a number of different messages that the pharmacy can send to patients via the solution. So the most prolific and common message is definitely the ready to collect message. So that's a really quick and easy task, as we saw in the demo earlier, just to click on the ready to collect button, and that will then send a message through to the patient to let them know that it's ready to collect. If the pharmacy has any problems with the order, for example, if the only 3 out of the 4 items are available, maybe one's out of stock, or it's a special and needs to be ordered, the pharmacy can actually add a note to that patient and tell them which items are ready and which ones aren't, and tell them the reasoning. Also independent communicating back and forth between the patient linked to an order. Both the pharmacy and the patient have got the ability to send messages to each other about, for example, OTC orders, or about pharmacy services, or just generally to inquire about sort of different things that they may want to otherwise phone up about. So having that ability to send those messages can really help reduce phone calls, and also sort of unwarranted sort of visits to the pharmacy, especially important during COVID times.
Thank you. Just a final question here around pricing. Are you going to drastically increase the price of the solution once pharmacies have signed up lots of customers to the app?
Yeah, so the short answer is no. I do get asked that quite a lot as well, actually. And I suppose that our approach to pricing and contracts is to be really open and transparent. So we recognise that when pharmacies decide on which repeat prescription app to use, they want a long-term partner. So you don't want to be changed after 3 months, a year, 2 years, 3 years. You want somebody that's going to work with you for the long term. Especially if you've had invested all that time and effort persuading your patients to use that solution. You want sort of confidence that the pricing structure is going to be consistent, and you know what's going to happen going forward. So our approach around contracts and price increases is we have a rolling contract, so that will carry on forever until either party serves notice on the other. We're really flexible on notice periods as well, so we don't sort of say you have to have a 1 year, 2 year, 5 year term, etc. You know, we're happy to sort of be flexible and allow pharmacy owners to have the notice period that they wish to have, and then we obviously agree an appropriate notice period for ourselves as well. And then I suppose with regards to the price element, so to make sure that we are upfront, what we do is we build in increases in line with retail price index, RPI, which means that therefore, obviously, you know, we hope that pharmacies will stay for us for the long term, and each year all that will happen is the price will go up in line with RPI, which in effect means that the price stays the same over 1 year, 2 years, 5 years, etc. as time goes on. Our aim is really to help pharmacies have the confidence and do everything possible to, you know, feel really confident to sign up as many patients as possible, Therefore we've, our approach reflects that, and we want people to really feel comfortable contractually, as well as sort of trust us in the way that we approach our pricing on our contracts.
Thank you for answering those questions, Gwyn. Appreciate that. That's all the questions for now. As I shared, what we'll do is we'll review all the questions in the chat function and produce a summary response to all of those and circulate those after this webinar. Just as we conclude, Gwyn, can you summarise kind of the next steps and how people can sign up going forward? Thank you very much indeed.
Signing up with MedAdvisor is easy as 1, 2, 3. If you'd be interested to watch the demo again, you can use the QR code, which is on screen at the moment, but we've also included the URL below it, should you wish to type the URL into your internet browser. Additionally, if you'd like to have a conversation with me to answer any questions that you may have as you make your decision, please use the QR code or the URL to actually book some time in my diary. I'd be delighted to have a conversation with you to answer any questions that you may still have. And then after you've made your decision, really easy to get you set up. We'll agree a start date, send you over the documents that's for you to sign, and we'll get you going. So thank you very much for your time this evening. Please do reach out if you have any questions, and I look forward to hearing from you soon.